just announced this unmet needs project where we interviewed a sit-down interview with more than 100 of our senior Harvard faculty. So that's a way to get insights into the future. I would say also just looking at what is recently arrived in the market, especially things like GLP-1. The world is going to change because of that. So looking at some of the new gene and cell therapies that have arrived, and things like the ultimate impact of GLP-1 and related, and that was focused here at the forum. Hard to overstate that because it's going to cut across so many categories. And of course, then there's generative AI. Hasn't quite hit deployment level that has been predicted, but it will. It just may take longer. So all these are game changers. 20 years from now, people will look back at this period, this couple-year period, as a profound pivot point in American and global healthcare.
Improvement of quality, safety, efficiency, patient satisfaction, while meeting our goals for margin, so our financial goals. And so what we're interested in terms of innovation, first and foremost, is how do we leverage data in order to improve what it is that we do on the domains that I just mentioned. To that end, the use of data can help us with workforce efficiency. It can help us in terms of outcomes for patients. It can also help us in terms of engagement of patients. So as an example of some of the things that we're doing, specific things that we are doing, we are delivering tools to help teams function better as it relates to safety. An example is to try to determine whether there are variances in what is written in a chart and what might be ordered in the chart. And that gap, which can reduce safety events, is something that can be closed using technology. On the patient experience side, we are interested in developing and delivering novel tools that will help engage patients around their care.
I'm very optimistic about AI trends in healthcare over the next 7 to 10 years. I like to say that we're probably over-promising in the next 3 to 5 years because it's important that we rigorously evaluate all of these tools and interventions to make sure they actually work. But I think over the next 7 to 10 years, we're going to find a whole host of things that help us improve the experience of both delivering and receiving care. My advice to healthcare startups is to focus on the people, the process, and the technology. It's not about the shiny objects, it's about the problem that you're going to help solve. And that problem solution needs to both align with workflows and generate value in the system.